the cancer spreads actually in other organs or in other tissues, then it's done actually to be very difficult actually to treat. My name is Olivier Guenard and I work at the Artwork Center from the University of Bern. We develop advanced in vitro models that are called organs on chip, and our focus is on the lung and its diseases. So imagine tiny living models that replicate the real human lung, that breathes, that react to specific treatments and show us actually what is going wrong in diseases. Here we face three major challenges. The first one is really to identify the biological or clinical question we are trying to answer. The second is really to replicate this tissue. So in our case, lung microvasculature with a primary tumor. So we could really identify or observe how these cancer cells would detach actually from the primary tumor, end up actually in the bloodstream, and settle actually in a secondary site where they would form a secondary tumor. And third, and this is probably the most tricky part, is really to make sure that this tissue does behave like in vivo. Imagine actually we could use patient cells on these devices, and we do that already. That means we could have a lung on a chip for a specific patient. And the beauty here, or the potential here, would be that we could test specific treatment for this specific patient, and we could identify the best possible treatment for this specific patient.